Hello, good afternoon. My name is Dr. Chudi Explains of Snowspirations Global Health Solutions. Thank you and welcome to this weekend's open clinic. And today we're going to talk about a topic which actually every singular person in attendance this afternoon should know about. We're going to talk about sexual health. We're going to look at the concept of orgasm. How many of us are actually enjoying our sexual health? How many of us are actually attaining the peak of our sexual health, just like we are expected to attain peak of our physical health, of our emotional health, of our mental health? So we're going to talk about orgasms, okay? We're going to talk about it as adults. Unfortunately, this topic, it's rarely exposed. It's rarely discussed. So many people have so many misconceptions. So many people demonize it. So many people spiritualize it. So depending on where you're coming from, especially for women, unfortunately, what the data is telling us about women and sexual health and orgasm and climax or come, whichever one you choose, it's very, very, very poor. Now, our community, it's not just a community that will come in and tell you how to have babies. We also want you to enjoy yourselves when you are planning to have babies. So lovemaking is not just to have babies. There are two principal roles of lovemaking. When you are making love with your partner, you are procreating and you are also having pleasure. From our experience, when you go to the arena of lovemaking and you don't just think about having babies, when you relax and you have a buying effect and you participate and you know your audience and you have the knowledge and you have the right attitude, you're going to get good outcome. So if you practice your PPP, today we're talking about the second P. We're talking about love making. We're talking about having the climax, reaching the peak when you engage with your partner. So just give me a few minutes and I'm going to tell you what you need to know. Now, it's important you stay back and you evaluate yourself. I cannot evaluate your own journey regarding your sexual health, but you have to understand that everything about your sexual health is as important as your physical health, is as important as your mental health. If your sexual health is in a good place, the possibility your mental health will be in a good place is very high. The possibility your physical health is going to be in a good place is very high. Let me give you one particular reason. If you notice, when you have an engaging, mutually pleasurable sexual encounter, what happens? Afterwards, you feel good, you feel calm, you feel sleepy, you sleep. What happens afterwards? Your blood pressure will drop, your blood sugar will drop, your cortisol level will drop. There's an important hormone that goes up. It's called endorphin. So there are so many buy-in effects. There are so many positive trends you can glean from when you truly and genuinely engage in the act of lovemaking. It's a process. If you don't know, you learn. Now let's talk about human orgasm. So human orgasm is actually regarded as the peak of sexual excitement. So it's a build-up. So it's more like someone climbing the mountain. So orgasm, it's getting to the peak of the mountain. So when you're engaging in sexual intercourse in any shape or form, consider yourself traveling to the mountain with your partner. Consider your partner being in the same position with you, holding your hands, making sure you're not lagging behind. Unfortunately, in this process, when two partners are traveling to that mountain, most times the men will get to the peak. The women, some of them will not even start the journey. Some of them will be at the bottom. Some of them might be at the 50% of the finishing line. But most men will get to the top. Now, it doesn't make sense in a sport to leave your partner behind. So what we're going to do today is to understand what you need to know about your ability to get to the top. So it's the peak of sexual excitement. It's described as the powerful feeling of physical, mental, emotional pleasure and sensation, which both males and females will experience during sexual encounter. Now, I want you to pay attention to the next statement. You can experience this with your partner, and you can also experience this by yourself. So we normally misconstrue a lot of things. This is 2021, okay? So the fact you're not in a good place with your partner, the fact you have so many barriers, still should not prevent you from reaching the peak by yourself. You're an adult, so go for what you want. Go for what makes you happy. Don't be expecting the whole world to come to place before you begin to enjoy yourself. Listen to me carefully. There is absolutely nothing wrong in enjoying your sexual health. It's given to you. You need to maximize it, okay? So it can be solo or it can be with your partner. Now, unfortunately, in women's health, only few women actually attain orgasm, unfortunately. So in as much as whenever we talk about sex, people go out there, they get so agitated, they get so excited. Unfortunately, only few women have actually experienced orgasm. And it's not because they cannot experience orgasm, but because their knowledge, their attitude, and their practice of sex, it's flawed. So some of them go into sex with the mindset of committing sin, with the mindset of thinking is wrong, it's evil. So they demonize it. And what you give into anything you do is what you get. So the more you feel relaxed, the more you can have a buying effect. Majority of women fake their orgasms simply to satisfy their partner. So if you're going to a sexual relationship, if you're about to have sex with your partner, and your main aim is to satisfy your partner, which is okay. You love each other, you want to satisfy your partner, but the question is your partner satisfying you? Unfortunately, the way the anatomy of the penis and the vagina and the clitoris is structured, a man can easily climax, easily. A woman, it takes time. So if you're going into sexual encounter with your partner with the aim of satisfying your partner all the time, you're getting it wrong. It's an equally vested venture. So don't fake orgasm when you're not there to make your partner feel good, because any which way he's gonna orgasm, he's gonna ejaculate. So when men ejaculate, that's the peak of their orgasms. Okay, women can also ejaculate. So it's wrong to go into sexual encounter thinking only about your partner without thinking about yourself. Sexual encounter should be mutually desirable and pleasurable. Compared to women, men can easily have orgasm during sex. So 99.9% of sex in men will lead to orgasm. Majority of men will ejaculate. Some men will even ejaculate before they go into the vagina. That's the way their body is structured. So women have a big disadvantage. And the earlier you understand this, the better you need to appreciate the fact that your body is given to you also to explore. Okay, so it's important to understand that as a woman, your sexual health matters, just like your mental health, just like your physical health. Now, during orgasm, both males and female will discharge. So they will have visible discharge. Mainly in men, 100% they will discharge. That discharge will lead to ejaculation. In women, some will also ejaculate, not all. But when you orgasm, you will know within your body. Nobody will tell you that. Now, men and women will release fluid from the penis and the vagina. So you need to know this. So in case of sexual encounter, for some women, don't stop yourself when you are about getting there. There are some women, they will actually be in the process of having orgasm, and their partner will be the one that will stop it. So they will feel like, oh, I'm committing or I'm being promiscuous because I'm trying to express myself. And some of them can actually have different expressions when they are orgasms. So some people can have what we call squirting. So fluid will start coming out from your vagina, and they will be like, oh, I'm peeing on the bed and stuff. They are all part of the sexual pathway. There is absolutely nothing wrong with it. So stop stopping yourself from getting to the destination. Unfortunately, so many women don't know this. The ones that know about it, they know that when you get there, it feels like heaven. So what's the science of orgasms? You see, at the buildup of sexual intercourse, your body will release hormones called endorphins. Endorphins are extremely feel-good hormones. When you have enough endorphins in your body, nothing matters. Even if the world is coming to an end, you don't care. This is what happens when you are getting to that climax, orgasm zone. There are a couple of other hormones that will also be produced: dopamine, serotonin, oxytocin. They are all hormones that will make you to feel good. So when you release the endorphins in your bloodstream, it will cause you intense pleasure and relaxation. So if you notice, no matter how stressed you are, if you engage in good sexual intercourse, the next thing that will knock on your door is what? Sleep. It's not by magic. It's not by accident. So orgasm is the peak of sexual arousal, when all the muscles in your body will feel tightened in sexual arousal. So if you're a woman, if you pay attention to your body, if you are not feeling guilty, if you are not feeling like you're committing sin, pay attention to your body. When you are about to orgasm, when you are about to climax, when you are about to come, the whole muscles in your body will go into contraction mode. Some men will feel like their women are having epileptic fits. So you will be shaking your vaginal muscles, your womb muscles, your anal muscles. Your whole body will be shaking. It is the way God planned it. You are not going into epilepsy. You are not going into electric shock. It's the way it is. So people will feel a flush of warm feeling in their vaginal area, in their G-spot. So you will experience what we call muscle spasms. So if you pay attention to your body as a woman, you will experience some contractions in your womb, a feel-good feeling, contractions throughout your body, mainly in the genital area, your breast, your mom pubis, your clitoris, your anal region, that thick muscle between the vagina and the anus is called the perineum. You will feel this intense pleasure in this area in your body. It's completely normal. It's not abnormal. Now, 100%, it's okay. A guy might usually orgasm and release the fluid, which we call cum. Okay. But for women, just about 10% will ejaculate. So if someone asks you if women can ejaculate, the answer is yes, women can ejaculate, but only 10% will ejaculate. Now, when you compare ejaculation, when you compare orgasm between women and men, both can experience it differently. Women experience it in different way compared to men. Not all women will experience orgasm the same way. Sadly, majority is often the case. They will not experience this. Men, 100% of time, will do this. Now, the fact you're not experiencing orgasm in your sexual encounter doesn't mean it's abnormal. If you work more on it, you can get there. Every woman has the potentials of having orgasm. It depends on where you are. It depends on your physical presence. It depends on your emotional presence. It depends on virtually everything in your mindset. If your mind is filled with so many worries, if your mind is filled with, I don't have a baby, I'm stressing, I don't have money, you are not going to orgasm. Then your partner will orgasm, because the penis will always, once the penis is erect, the next thing the penis will do is to vomit. That's the way it is. So some women are less likely to achieve orgasm compared to men because of who they are, because of their sexual experience, because of their religious belief, because of their cultural belief. There are some women that believe when they marry, their duty is to go have all the kids in the world. Your duty is not to be a baby-making factory. Your duty is to also make sure you have the best sexual health. So with men, you can easily have that. With women, you need to work on it. You need to work on it. Okay? So what are the remedies? If you are concerned and you feel you are not having orgasm with your partner, communication. You have to talk about it. Communication is key. Then you learn. In our group, we have a PDF for best sexual health. Sex is for adults. It's not for kids. You don't gain anything being in a relationship with a man you say you love. You can have all the money in the world. You can love him from Jalingo to Jericho. If you guys are not enjoying your sexual relationship, forget about it. Sex is one of the biggest problems that damage relationships out there. You can have all the money in the world. If you are not satisfying your partner, they will begin to look elsewhere. And this is applicable to both women and men. So talk about it. Letting your partner know what you care about. Some women have pleasure in their breast, in their clitoris, depending on where it is. Discover your hot spot and communicate with your partner. A woman is supposed to have a special place called the G spot. This is the area in your vagina where you have the biggest pleasure. Also, the clitoris is where you have the biggest concentration of cells that will make the woman to get there on time. So study your body. Don't limit yourself. Don't hold yourself back. Then communicate your need. Any woman out there can easily achieve orgasm in different ways, by different means. There are different ways you can achieve orgasms. That's a very good thing for women. Men can only orgasm in one particular way. So there are different types of ways a woman can achieve this. Your body is capable of experiencing orgasms in different ways. So you continue to talk about this. You continue to make sure you know what you need to do, because even in the scientific world, we are constantly renewing our knowledge about the ability of a woman to orgasm. So how do you achieve this orgasm? It has 4 phases. The first phase is the excitement phase. In this phase, you desire to have this arousal, you desire your partner, you begin to initiate the talk about sex. This starts with you finding your partner attractive, focusing on the sexual stimuli in that moment, forgetting any other thing. When you are in this phase, blood will begin to build up in your vagina, in your clitoris, in your nipple, and all over your body. When blood rushes into all this area, you begin to feel the excitement. You can practically see yourself blushing. Your heart rate will go up. Your blood pressure will go up. If you notice, especially if it's your sexual experience you're hiding to have, what do you normally notice? Your heart is racing. Your blood pressure is all over the place. You are hyperventilating because you are excited. What we call the sympathetics in your body is excited. So you want to get to that mountain. And if you want to get to the mountain, you are so excited. So these are all normal. Your blood pressure is going to go up. Your heart rate is going to go up. Your blood sugar is going to go up because you are about to embark on a journey. Now, everything about your sexual urge interest is under the control of testosterone and other neurotransmitters like dopamine, like serotonin, like the endorphin I asked you guys about. When all these things are firing, they will get you to the stage when you will start engaging in the practice. Now, the next phase is plateau phase. Sexual tension will build up just before orgasm. This you will know. So your partner has entered, it's probably, engaging in foreplay and all that, and you're so excited. You are right there. You are about to get there. Unfortunately, this is where most women will be stuck. This is where sexual encounter ends with most women. Once they get to the plateau phase, they don't get to the mountain because of their belief, because of the walls they built around themselves. So I want you to break the barrier. If you can get to the excitement phase, break the plateau phase. The outer 1/3 of your vagina will be particularly filled with blood. The same mechanism is what happens to the penis. How do the penis get erect? When blood enters the penis, it's going to be erect. When blood leaves the penis, it becomes flaccid or it becomes limp. So when you feel this blood, it will rush into the area and it will create what we call orgasmic platform. Focus on everything that will get you to the mountain. Don't stop there. Communicate, initiate, find the best sexual position that will get you there. Don't be a passenger in your sexual act. Participate. So when you get there, you focus on the stimuli, you keep basking in it. Once you are able to beat your plateau phase, you now get to orgasm phase. This is the calm phase. This is the climax phase. This is the phase that every woman should experience. If you have experienced this, when people talk about heaven, you will know what it feels to be in heaven on earth. If you have not experienced this, it doesn't mean you can't experience this. It means you are the one delaying yourself from experiencing it. Your partner can play a role in you experiencing it, but you also have a role to play. When you get to the orgasm phase, the sexual tension will build up, then everything will be released. You will begin to feel that sense of fulfillment physically, emotionally, spiritually. Then your muscles will begin to contract. Afterwards, you have this warm feeling that will radiate throughout your body. Then afterwards, the last phase is the resolution phase. So once you've achieved orgasm, once you've had come or climax, your whole body will feel calm. Some people will sleep. Some people's heart rate will come down. Blood pressure will come down. Virtually everything will start coming down. Now, what are the types of orgasms? Like I mentioned, we're focusing on women today. There are different ways women can orgasm. There are different parts of their body that can lead to orgasm. We have about 12 different types of female orgasm. But the most important one is the clitoral orgasm. So the orgasm that will emanate from your clitoris. This is the most important one you need to focus on. Vaginal stimulation can also lead to orgasm. G-spot stimulation can also lead to intense sexual pleasure. Now, some women will begin to wonder, do I really have this G-spot? Yes, every woman has a G-spot in their body. But if you don't pay attention to your body, you will not discover it. It's possible you've discovered it before, but because of your lack of knowledge, because of your ignorance, you haven't really explored it. So G-spot is an area felt through the wall of the vagina, just an inch or two behind the back of your pubic bone. This is near the junction of the bladder and the urethra. They are made up of very sensitive tissues in the clitoris, in the urethra, and female prostate gland. This is the area that when you stimulate, when your partner stimulates, both the hands, the penis, or whichever way, people that engage in oral sex, when you can get to the G-spot, when you can stimulate the clitoris, you will get there if you don't restrict yourself. So the female orgasm, it's something you can achieve today if you let go, if you and your partner can talk about it. So what are the problems involved in getting there? There are so many physical problems that can make you not to get there. You might be sick, you might be worried, you might be depressed, you might have anxiety. They can all contribute to your inability to get there. But the biggest problem is your emotions. If you're not in a good place with your partner, you will not get there. Your partner will get there. If you are always thinking about having babies, you might not likely get there. You might end up having your baby, but remember, you're not a baby-making factory. So your emotions can play a lot of role. So work on your anxiety level. Work on your depression scale. Work on your stress level. Stop feeling fear. If you are still in it, I understand. But if you're in a legal union, boy, girlfriend, fiancé, married and whatever you have, whichever way, please stop the nonsense of fear. Stop feeling this intense fear, guilt, distractions, and loss of control. When you begin to feel all this, it's going to rob you your orgasm. If you have never experienced orgasms, begin today to think about it. Begin today to practice it. Begin today to take charge. Begin today to communicate it with your partner because you can get there. Men can also have problems with orgasms, especially if they have erectile dysfunction. There are some men that previously they can make love from morning till night, but suddenly their penis cannot even rise. It's a medical problem. It's not people from the village. So the earlier you seek help, the better. Okay? So now I'm going to open the clinic and I'm going to give you an opportunity to ask your questions in real time. So it's time for questions. In next 7 minutes, we'll have an opportunity to ask questions and I give you feedbacks. So please go ahead and ask your questions right about now. Okay? Dr. Ndiche, thank you for coming. My COO, thank you for coming. I can see you. What about fertility treatments? Okay, please, can you rephrase your question properly, COO? What specifically about fertility treatment? Okay, thank you, Doc, for the teaching. For women with low libido, what can be done to increase libido, especially when trying to get pregnant? First of all, you have to deal with your reality. You have to stop being in denial. You have to work on yourself. You have to work on your stress level. You have to eat good food. You have to sleep. You have to have healthy body weight. These are natural things you can do. Avoid your alcohol. Avoid your smoking. Be in a good place. Be intentional. When you do all this, you have the ability there already. But when you allow yourself to be overwhelmed with anxiety, with depression, with infertility, with guilt, with fear, with distractions, you're not going to get there. Now, if you have done all these natural means and you're still having low libido, which by default, as you're getting older, your libido will be dropping by default. Every woman is going to get to that point. So that's the stage you need to take up your responsibility and work out your salvation. So if you have very good, healthy lifestyle, you exercise, you eat good food, you drink water, you sleep, you don't allow things bother you, you can still be making love up to your 90. But when you allow the world to overwhelm you, worldly cares, stress, all over the place, you won't even remember you have a vagina. That's a fact. So age will affect you, but what you do when it gets to that point is very important. Some women naturally have very good high libido, okay? That's a plus. The majority of women there, as they are getting older, when they get to age 35, they will discover they don't even have interest in sex again. And now when you begin to have kids, kids have a way of modifying your sexual interest, and also depending on your partner. So there are some women in this gathering today, you've not made love since 2021. Or the one you made, they just used you, your partner plugged in and came out, but you haven't really participated. So you need to have a role in your own natural management. Now, if you've done this naturally and you're still not able to get there, then you begin to seek for help. Okay? All right. Yeah, Kenneth, what do you mean? What's your question about fertility treatments? Please, can you rephrase and please keep asking more questions. If your questions are not answered, probably I'm not seeing them for some reasons. We notice that sometimes some questions are missed. And Ebenezer, if you're out there, also ask your question. Keep asking your questions. Dr. Ndiche, you can also ask your questions, please. Keep asking your questions. I'm here to attend to you. Looks like you can't see your questions. Yeah, I'm not seeing your questions. Can you repost again? I don't know if they're selecting questions. For some reasons, I can't see your questions. But please ask again. Okay. How does female orgasm relate to consciousness? Everything happens in the mind. If you make up your mind to orgasm, you will get there. But if your mind is stuck to that plateau phase, you won't get there. So work on your mind, work on your knowledge base, work on your attitude, work on your practices. Like if your mom told you when you were growing up that sex is evil, when you go into relationship, you have that mindset that sex is evil. So even when you're married, you will also see that the sex you're having with your partner is evil. So you're not going to orgasm. So unfortunately, there are so many women that will not experience this until they die. You're missing a lot. Believe me, you need to experience this. Okay? Please keep asking your questions. Kenneth, for some reasons, I'm not seeing any of your questions, and I know you have a lot. Ebenezer, I haven't even seen one question from you. I'm waiting for the questions. Please keep asking the questions. I'm going to release my transcript. This is a topic that so many people need to know more about. There is no need pretending about it. You are an adult. If you have problems, seek help. Now, if you have any specific problem in your relationship, we can help you. So you can come to our group, you can get a subscription, then I can walk you through. I can find out what the problem is. I can guide you and see what I can do to help you. So don't die in silence. You need to experience this. It's your right to experience this. Life is not all about having kids. Life is not all about being overtly spiritual. If God gave you any part of your body, He gave you a part of your body for a reason. So the same way you enjoy every part of your body, making sure they are cool, making sure you get the best out of them, the same way you should also enjoy this aspect of your body. Very important. Okay? Please keep asking questions. Keep asking questions. For some reasons, I'm not getting any question from my crew. Okay, let's do this. Please go back to our group and send me your questions, then I will look into my phone and provide you feedbacks. Let's navigate through that way. So go to our group and drop your questions to me directly, okay? Let me look for them now. Okay, let's see. All right. Okay. Yeah, is gonna, what's aphrodisiacs? Okay. So aphrodisiacs are special chemicals or elements or factors that bring you forth, that helps to accentuate your partner's interest, your partner's desire. So aphrodisiacs can be maybe in form of food, maybe in form of a particular, chemical, a particular cream. So aphrodisiac are things that will kickstart that interest in going for your partner, in wanting to meet your partner, in getting to that sexual level. So they are called aphrodisiacs. Some people kick into that aphrodisiac mode simply by seeing their partner's naked body, or they eat a particular food, or they are touched, or they feel a particular scent, or they have a particular candle. It's just, those things that wake up the sexual interest in your partner and make you to go there. That's what aphrodisiac is all about. Okay, so let me see. I believe I have Kenneth's question right now. So let's see. Ebenezer, we need to work on the reason why I'm not getting questions, okay? Much later. Can gynecological problems cause issues with orgasms? Yes, it can. Some women can have some gynecological problems, which can affect the blood supply, which can affect the innervation, and it can be structural problems. Sometimes it might be traumatic experience. Sometimes it might be overwhelming pain, big fibroid, endometriosis, polyps, things that will ordinarily alter your pain pathway. When you are not in a good place, pain is not supposed to be painful. So if you have intense pain, dry vagina, or lack of confidence, vaginal odor, or discharge, it can affect your act of sex. And if it affects your act of sex, you are not going to achieve orgasm. So the answer is yes, it can happen. What about treatment? So if you have specific gynecological problems, endometriosis, fibroid, polyps, hormone imbalance, whatever it is, when you seek help from a gynecologist, when we address that problem, you can improve your libido. And when you improve your libido, when you participate in sex, you will have the ability to achieve orgasms. Okay? All right. For some reasons, I'm not seeing any question. So I'm going to revert back to picking them off from my phone. So admin, keep asking your questions through our forum. Okay, Ebenezer, is there any such thing as super orgasm? It's just a mind thing. When you orgasm, you orgasm. Okay? So there is no super or low. When you get there, you get there. Now remember that people can feel this differently. Some women can get to that orgasm zone and they can ejaculate. Some women can release fluid from their vagina. It's called squirting. So it's the same thing. Some women can get there and they are silent. Some women can get there and they are shouting like they've gone crazy. So you can experience this differently, depending on your own orientation, depending on your own individual understanding, depending on your own sexual experience. Unfortunately, we talk about sex a lot, but only few people actually know how to make love. This is a fact, especially people that believe that everything is all spiritual. So if you don't know, you can learn. Okay, so your second question says, how long does female orgasm last? Is also individualized, okay? But it's just a split minutes, probably up to 1 minute. Now, some people can have multiple orgasms, especially women. Women can have one orgasm and it will build up, depending on your role, depending on your partner, depending on how you got there. Most men will not have multiple orgasms because when a man ejaculates, once blood leaves the penis goes flaccid, the penis goes into sleep mode. So for you to become erect again, you need to work on yourself. But everything is all about practice. Some men can actually have another kick and they can go back and forth. But most women are the people that will experience multiple orgasms. So multiple orgasms means you experience one, another one is coming, another one is coming. So many women have this ability to experience it. If you are in that category, go along and make sure you get the best out of it. Okay? All right. How do you get out of your head? How do I get out of my head enough to orgasm? Everything is all about the mind, Onyi. Everything is in the mind. Before you go into that act, believe you will orgasm. Communicate with your partner. Participate. Problem is women are not participating. Some women will feel like shouting. They won't shout because their partners will think they are promiscuous. You are not doing your partner a favor. He is not doing you a favor. You have a buy-in effect. When you go into that sexual act with inferiority complex, with the fact that, oh, you're committing sin, you're going to get exactly the same feedback. Okay, so one more question, then I'm done for the day. Is there a difference between clitoral orgasm and G-spot orgasm? Yes. The clitoris and the G-spot are two different areas, which can elicit different places that a woman can be stimulated and she can have orgasm. How do you know if you've had orgasm? The experience I mentioned about is a personal thing. You will feel an extreme, intense, physical, emotional type of relaxation and, jerky movement all over your body. It's a personal experience. If you have experienced this, nobody can explain it better than yourself. Okay, so thank you for coming today. My next clinic is going to be on Tuesday, 7 p.m. Eastern Time, 1 a.m. Nigerian time. Please go out there as a woman and overcome this cultural limitation towards having the best sexual health. Enjoy your sexual health. Enjoy your love making. Make love, make babies. Enjoy your weekend. I'll see you guys tomorrow. Now, if you don't know, something amazing is going to happen in this group on the 19th. We are organizing a super masterclass. Now, I believe you've been having challenges accepting the fact that you're going to be a mother next year, right? You're going to be a father. Guess what? This can end in double. This can end in triple. This can end in quadruplets. So take your bold step. We're going to talk about IVF and the possibility of having multiple pregnancy through IVF. So make sure you go out there and register. It's on the 19th, before Christmas. So make provisions for this so that we are going to enter our 2022 with joy, dancing, and dazzling. God bless you and enjoy your weekend. Bye-bye for now. Yeah.